In the past week, there have been more than 300,000 new cases of COVID-19, and that includes an outbreak believed to have originated at this White House Rose Garden event. President Trump suggested he may have contracted the virus there as well. Meanwhile, states like New York, New Jersey, and Maine are all preparing for a second wave as new cases are on the rise there. The good news, though, is that more and more people are recovering from the virus, including Tony Perkins of the Family Research Council, who contracted the virus back in July. Earlier this week, I asked him about his road to recovery.
It was like a really bad case of the flu. It came on and sort of feeling bad, and I was with fever, you know, the sweats and the chills for about 3 days. In the midst of that, did get tested because I thought I may have been exposed to it as I was doing a lot of traveling. And after that, it was just weakness for about 10, 12 days, and then recovered from it. And we tried to isolate as much as possible in our family. My daughter's actually an ER nurse working with at the time working with the coronavirus patients, so we're not sure if maybe that's where it came from or through traveling. But it's kind of gone through the entire family, and now everyone is on the other side of it. And just recently I was tested, had the antibodies.
Tony, you just mentioned it. You tested positive for COVID antibodies. Some think that means you're now immune. What did your doctor tell you about that? And are you or have you considered donating plasma to help others who are fighting the disease?
Yeah, I'm looking at that. We're looking at the research, and in fact, we may issue a challenge to all of our churches in our network for those that have tested and have the antibodies to give the plasma if you know we see that is a very effective means. It's actually as a part of John, the defense of this for the broader society is people get this, they become barriers to the spread of it. So it's actually good, and medical professionals are actually saying now, you know, we need to get out, we need to move around. Not only physically is it good for us, but psychologically, what's happening to our country as we've been in this lockdown, isolation is not good for us. We're seeing an increase in suicide, drug abuse, and so it's time to get back to a sense of normality in this country.
You were at the White House, but your COVID experience was from earlier this summer. I'm curious, what has been going through your mind as you've watched what has been taking place over the last week or so?
A couple of things. Number one is, I think, again, we cannot stay in hiding from this. I mean, you know, those that are in compromised situations, immune systems, or they have underlying issues, we need to protect them. And so we need to encourage them not to come out to these events or not to really socialize in vulnerable situations, and we need to take care of them. But we can't have everybody in hiding. We need to get healthy people really have to go through this. And I want to say this about the president. I was so, you know, if I could use the word, almost inspired and encouraged that the president said, look, it's exactly what we've been saying from the standpoint of saying to the church. He said it. He said, we can't live in fear of COVID. And that is so true. We cannot live in fear, and especially the church. This is a moment for us where we need to be leading. And quite frankly, I don't think we've done a really good job of it.
And Tony, along those lines, FRC is holding an event called Freedom Sunday this weekend. How does all of this tie in together, and what's the ultimate goal?
Now, we're actually doing this in California in a church, 8 p.m. Eastern Time, Sunday night. We'll be in Calvary Chapel, Chino Hills. You'll be hearing from pastors like John MacArthur, Rob McCoy, who these pastors, Che Ahn, pastors who have been fined or threatened even with jail time. We'll hear from some of the biblical scholars about the stand the church should take. Dr. Al Mohler will be joining us. Eric McTaxis will be joining us. And it's a challenge for us to stand in the face of this fear and live in faith. Again, making sure we take the necessary precautions, protecting those who are vulnerable. But we have seen, John, the effects of the church being shuttered for 8 months. Chaos in our streets, the depression, the discouragement, the suicide rates increasing. It is time for the church to take this head on and stand with confidence in the face of uncertainty.
Tony, I'm sure a lot of people will be interested in that. Tony Perkins, president of the Family Research Council. Tony, thank you so much for being with us today.
Thanks, John. Good to be with you.